Welcome to the new video MCQs on Bacteriology Part 2. Question number 1. A patient presents with chronic gastritis. Rapid urease test from gastric biopsy is positive. What is the major virulence factor responsible for ulcer formation? Urease, CAG-A or VAC-A, capsule, hemolysin. The right answer is option B, CAG-A or VAC-A. CAG-A and VAC-A are major virulence factors of Helicobacter pylori. VAC-A causes vacuole formation and epithelial cell injury. CAG-A disrupts cell signaling and increases inflammation. Together they lead to ulcer formation. Question number 2. During a hospital outbreak, a gram-positive cocci shows resistance to cefoxitin. Which gene is responsible? BLAZ, CAT-G, WAN-A, MEC-A. The right answer is option D, MEC-A. The MEC-A gene encodes PBP2A, an altered penicillin-binding protein with low affinity for beta-lactam antibiotics. This gene is responsible for methicillin resistance in Staphylococcus aureus detected by cefoxitin resistance in lab. Question number 3. A patient develops fever, rash on wrist and ankles, severe headache after a tick bite. Wheel Felix test is positive. What organism is responsible? Coxiella burnetii, Rickettsia rickettsii, Borrelia burgdorferi, Francisella tularensis. The right answer is option B, Rickettsia rickettsii. The symptoms fever, severe headache, rash starting on wrist and ankles, and a history of tick bite are classic for Rocky Mountain spotted fever caused by Rickettsia rickettsii. The Wheel Felix test often shows positivity in rickettsial infections. Question number 4. A 7-year-old boy presents with painful swelling of the jaw and a history of dental caries. Pus shows gram-positive branching filaments that are anaerobic and forms sulfur granules. Identify the organism. Actinomyces, Nocardia, Clostridium, Bacillus. The right answer is option A, Actinomyces. Actinomyces israeli is an anaerobic gram-positive branching filamentous bacterium that commonly causes cervicofacial actinomycosis, that is lumpy jaw. The presence of sulfur granules in pus is a classic diagnostic feature. Question number 5. A 24-year-old male develops hemolytic uremic syndrome after diarrheal illness. Stool culture grows lactose fermenting colonies on McConkey agar. Which strain is responsible? Enterotoxigenic E. coli, enteroinvasive E. coli, enterohemorrhagic E. coli, enteroaggregative E. coli. The right answer is option C, enterohemorrhagic E. coli. Enterohemorrhagic E. coli produces Shiga-like toxin which damages the endothelial cells and causes hemolytic uremic syndrome. It shows lactose fermentation on McConkey agar and appears as pink colonies. Question number 6. In a case of neonatal meningitis, CSF culture grows motile gram-positive rods showing tumbling motility at 25 degrees Celsius. Which test helps to differentiate this organism from diphtheroids? Catalase test, PYR test, triple sugar iron test, CAM test. The right answer is option D, CAM test. The organism described, that is motile gram-positive rods showing tumbling motility at 25 degrees Celsius, is Listeria monocytogenes, a major cause of neonatal meningitis. Listeria is differentiated from diphtheroids such as Corynebacterium by a positive CAM test. Question number 7. A 28-year-old develops fever, jaundice and muscle pain after swimming in contaminated water. Microscopy shows tightly coiled spirochetes with hooked ends. Identify the disease. Lyme disease, relapsing fever, Weil's disease, yaws. The right answer is option C, Weil's disease. The description of tightly coiled spirochetes with hooked ends points to Leptospira interrogans. Severe infection causes Weil's disease, characterized by fever, jaundice, renal failure, and muscle pain, often after exposure to contaminated water. Question number 8. A patient develops osteomyelitis with blue-green pus that has a fruity odor. Which enzyme contributes to the organism's virulence? Pyocyanin, lecithinase, coagulase, urease. The right answer is option A, pyocyanin. The blue-green pus with fruity odor is classic for Pseudomonas aeruginosa. Its virulence factor pyocyanin generates reactive oxygen species, causing tissue damage and promoting the blue-green pigment seen in infections like osteomyelitis. Question number 9. A patient develops fever and abdominal pain. Vidal test is positive with TO and TH titers significantly elevated. Which phase of disease is being diagnosed? Carrier state, early gastroenteritis, enteric fever, chronic typhoid. The right answer is option C, enteric fever. A positive Vidal test with elevated TO and TH antibodies indicates an active Salmonella typhi infection. This pattern is characteristic of enteric fever or typhoid fever. Question number 10. A 30-year-old male presents with a painless ulcer on his genitalia and enlarged rubbery lymph nodes. The organism is seen as school of fish on gram stain. Which organism is most likely? Treponema pallidum, Haemophilus ducreyi, Calymatobacterium granulomatis, Chlamydia trachomatis L1 to L3. The right answer is option B, Haemophilus ducreyi. Haemophilus ducreyi causes chancroid, characterized by genital ulcer and tender lymph adenopathy. But on gram stain, the bacteria classically appears in a school of fish or railway track arrangement, confirming the diagnosis. Question number 11. A 6-year-old develops fever, malaise, and bullous impetigo. Nikolsky sign is positive. Which toxin is responsible? TSST1, hemolysin, enterotoxin A, exfoliative toxin. The right answer is option D, exfoliative toxin. Exfoliative toxin produced by Staphylococcus aureus causes cleavage of dysmoglein 1, a protein found in the upper layers of the skin. This leads to bullous impetigo and sometimes staphylococcal scalded skin syndrome. This results in skin peeling and a positive Nikolsky sign. Question number 12. In the gram staining procedure, which reagent acts as the mordant, forming a complex with the primary stain to fix it inside the bacterial cell wall? Crystal violet, safranin, iodine, alcohol. The right answer is option C, iodine. Gram's iodine acts as a mordant, forming crystal violet iodine complex that gets trapped within the thick peptidoglycan layer of gram-positive bacteria. This helps to differentiate them from gram-negative organisms during decolorization. Question number 13. A 40-year-old man presents with fever, neck stiffness, and photophobia. CSF shows elevated neutrophils, high protein, and low glucose. Which is the most common bacterial cause of meningitis in adults? Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitidis, Listeria monocytogenes. The right answer is option A, Streptococcus pneumoniae. In adults, Streptococcus pneumoniae is the most common cause of community-acquired bacterial meningitis. It is a gram-positive diplococcus and can cause otitis media, sinusitis, and pneumonia. Question number 14. During the bacterial growth curve, at which phase are bacteria most metabolically active and most susceptible to antibiotics? Lag phase, log phase, stationary phase, decline phase. The right answer is option B, log phase. In the logarithmic phase, the bacteria are rapidly dividing and metabolically active. Antibiotics targeting the cell wall or protein synthesis are most effective at this stage. Question number 15. During a microbiology lab session, a student performs Ziehl-Neelsen staining and finds red-colored rods. Which group of bacteria shows this property? Bordetella, Brucella, Mycobacteria, Clostridia. The right answer is option C, Mycobacteria. Mycobacteria are acid-fast due to mycolic acid in their cell wall. This retains carbylfuchsin dye even after acid-alcohol decolorization. Question number 16. A stool sample is collected for culture to diagnose suspected cholera. Which transport medium should be used to preserve the viability of enteric pathogens? Anaerobic transport medium, Carey-Blair medium, urine transport medium, blood culture bottle. The right answer is option B, Carey-Blair medium. For suspected cholera, the stool sample should be transported in Carey-Blair medium because it preserves enteric pathogens like Vibrio cholerae and prevents them from dying during transport. Question number 17. The Quillen reaction is used to detect which bacterial structure? Capsules, spores, flagella, fimbriae. The right answer is option A, capsules. The Quillen reaction, that is capsular swelling test, is used for identifying capsulated bacteria like Streptococcus pneumoniae, Klebsiella pneumoniae, and Neisseria meningitidis. Question number 18. A patient with atypical pneumonia has a culture showing small fried egg colonies on PPLO agar. Which organism is responsible? Mycobacterium, Mycoplasma pneumoniae, Corynebacterium diphtheriae, Listeria monocytogenes. The right answer is option B, Mycoplasma pneumoniae. Mycoplasma pneumoniae forms fried egg colonies on specialized media like PPLO agar, that is pleuropneumonia-like organisms agar. It lacks a cell wall and causes atypical pneumonia, especially in young adults. Question number 19. A stool sample is cultured to isolate Salmonella and Shigella. Which of the following culture media is most appropriate for their selective isolation? EMB agar, McConkey agar, SS agar, nutrient agar. The right answer is option C, SS agar. Salmonella Shigella agar is a selective and differential medium that inhibits gram-positive bacteria and most coliforms. It helps to differentiate lactose non-fermenters such as Salmonella and Shigella from other enteric bacteria. Question number 20. Listeria shows which type of motility? Umbrella, swarming, darting, tumbling. The right answer is option D, tumbling. Listeria monocytogenes shows tumbling motility at room temperature 25 degrees Celsius due to its peritrichous flagella. Question number 21. A boy presents with otitis media. Culture from ear discharge shows gram-negative diplococci that grow on blood agar but not on nutrient agar. Identify the organism. Neisseria meningitidis, Moraxella cataralis, Neisseria gonorrhoeae, Acinetobacter baumannii. The right answer is option B, Moraxella cataralis. Moraxella cataralis is a gram-negative diplococcus that grows on blood agar but not on nutrient agar. It is a common cause of otitis media in children. Question number 22. A patient with chronic cough shows red snappers on Ziehl-Neelsen stain. Which lipid is essential for acid fastness? Mycolic acid, lipoteichoic acid, cardiolipin, lipopolysaccharide. The right answer is option A, mycolic acid. Mycolic acid in the cell wall of Mycobacterium makes them acid fast, so they can retain carbylfuchsin dye even after acid alcohol treatment. Question number 23. A farmer develops lymphadenopathy and fever after skinning rabbits. The causative organism requires cysteine-rich media. Which is the organism? Yersinia pestis, Francisella tularensis, Pasturella multocida, Brucella abortus. The right answer is option B, Francisella tularensis. Francisella tularensis, the agent of tularemia, requires cysteine-enriched media for growth, and it is commonly transmitted while handling rabbits. Question number 24. A neutropenic patient develops fever. Blood culture shows railroad track appearance of gram-positive cocci. Identify the organism. Staphylococcus aureus, Streptococcus pyogenes, Peptostreptococcus, Gemella. The right answer is option D, Gemella. Gemella are gram-positive cocci that appear in railroad track or short chains arrangement. They are part of the normal oral flora, but they can cause bacteremia and infections in immunocompromised patients. Question number 25. A woman develops pelvic inflammatory disease. NAT test detects an obligate intracellular pathogen lacking peptidoglycan. Identify the pathogen. Chlamydia trachomatis, Mycoplasma hominis, Neisseria gonorrhoeae, Gardnerella vaginalis. The right answer is option A, Chlamydia trachomatis. Chlamydia trachomatis is an obligate intracellular bacterium that lacks muramic acid in its peptidoglycan layer, making it undetectable on gram stain and responsible for pelvic inflammatory disease. Thank you for watching the video. Subscribe to the channel to practice more MCQs on microbiology.